Hi, everyone. Thank you all for joining. I do want you all to note that the session is being recorded, and if you do not consent to being recorded, you're asked to drop off the session at this time. All right, we can get started. Good afternoon, everyone. My name is Darby Galligher, and I'm a project coordinator with the National Indian Health Board, and I will be moderating the session of the Don't Miss Your Shot COVID-19 Youth Summit. This is the youth panel where we will be talking to peers that may be vaccine hesitant. And we have three great panelists today. We have Alec, Casey, and Rory. But before we do get started with the session, I just have a few housekeeping notes. So as you all know, today's session is being recorded and it will be available for viewing after the meeting on our YouTube page, I would say like the end of next week. I've also enabled live transcript for the meeting today. And if you do wish to hide live transcript, click on the live transcript button, then hit add or click hide subtitle. Sorry about that. I do have all participants muted right now. Please leave yourself on mute unless we specifically ask you to unmute and engage. If you have any questions during our panel, please use the chat feature. And we will hold most of our questions until the end of the Q&A or end of the session, and then we'll start with a Q&A if we have time. And then if you have any technical questions, please reach out directly to me or to Adriana or Courtney via the chat function, and we will be able to help you out. All right, and the panelists, how we feeling? Do you guys want to introduce yourselves? Yeah. All right, Rory, you want to start us off?
Of course. Well, Nyawe Scano Kuguego. Seneca, I agree with you with. I'm thankful you all are well. My name is Rory Wheeler, and I'm a citizen of the Seneca Nation. My experience with the pandemic has been on the front lines of the pandemic. I'm 24 right now, but since I was 18, I've served as a volunteer EMT, as well as here in the Seneca Nation, our Allegheny and Cattaraugus territories here in upstate New York, as well as working with detail to our health center emergency preparedness throughout the pandemic in the early stages. I'm excited to be here to share some of my experiences and some of my perspectives on the pandemic, the vaccine, and response. I just recently graduated from Niagara University with my bachelor's in political science, and I'm applying to law school right now. So happy to be here and looking forward to today's discussion.
Thank you. Casey, you want to go next?
Yeah, for sure. So yeah, I'd say Shakara Shadene, Shay Twitter question initially, not to touching the Shin, touching the Shay Hotso additionally. Shmero Shai, Virginia Thomas Longwell, yeah, Kotsko the initially, Casey Q Long. Hello, everyone. My name is Casey Long, and how I introduce myself is how I identify as a Dene male. So I'm a member of the Navajo Nation, and I'm fairly young as well, and I bring multiple perspectives in with this pandemic, serving with a mutual aid, providing needed resources within my community, and also working with the National Indian Health Board within that time, and just transitioning back into my community and working with a new group. And so graduated very recent too with my master's in public health, and it's great to be here with you all.
Thank you, Casey. Alec, you are up.
Thanks, Darby. Miyam and the Tong Alec Calac Yaka, no on the Talman Guy. Good afternoon, good evening, everyone. My name is Alec Calac. I'm from the Palma Band of Luiseño Indians in North County, San Diego. I went to college at the University of Arizona, and I'm currently a medical student at the University of California, San Diego, which is also my background. I am currently pursuing medical school and graduate school. So I'm doing an MD and a PhD. My PhD is in public health, really focusing on tribal public health, social media, workforce development, and medical misinformation. So my efforts have really been, looking at Facebook, Instagram, Twitter, and looking at how people interact with misinformation and how it can affect their attitudes and beliefs about COVID-19 vaccines, and really just trying to strengthen the pandemic response across Indian country.
Thank you, Alec, and thank you guys so much for introducing yourselves. I have a few questions to ask you guys, but at the end, we should have some time to answer questions from viewers, which will be great. And attendees, if you have questions pop up throughout the panel, feel free to type them into the chat box, and we'll try to reach them at the end. And if we don't get to your question, I'll make a list, I'll send them to all the panelists, and then we can have them answer questions that way. Let's go ahead and get started with question one. Easy peasy, but what helped all of you guys decide to get vaccinated? Rory, if you want to start.
Sure. So working on the front lines of the pandemic, starting in March 2020, up until I went back to school in person full time till February, March 2021, it was to say the least, to be honest, it was devastating. You know, here in New York, luckily we've had a great response from the state, the tribe, and also the assistance we received from the federal government. But seeing our community just in such turmoil, this is a place I've lived, I've grown up here. It's a small tribal community where everybody knows each other. And then for me, as a first responder in EMT, as a community leader, I've been active in the Seneca Nation government. So it was just about 15 and served in numerous roles. It was pretty devastating to say the least. And I feel like I was worrying all the time. And then when emergency youth authorization came late, middle December, I remember being so excited that finally there was a light at the end of this tunnel. And at that same time, I was grieving the loss of one of my closest friends and mentors who passed during COVID. So on December 29th, I was one of the first, if not the first, members of the Seneca Nation to receive the vaccine, because I felt that it was so important to be a good example, be a good role model to other people, and as a way to curb this pandemic, because I know we're all getting tired of, what we're seeing and what things we have to go through, and this kind of what was known as the new normal. That was my primary reason, and that's my reason, getting my second and then even getting my third a few weeks ago. But nonetheless, the pros outweighed any cons that, you can think of. And happy to share my experiences with everybody. I know I had community members calling me all day, every day, asking questions about it, how I was feeling. Even this last booster shot I had a few weeks ago, which was fine. And my mother got hers yesterday. And people have been calling and asking for suggestions and guidance, and always happy to provide that.
Thank you, Rory. Thank you so much for sharing that. And I'm so glad to hear your booster went well. Casey, what about you? What helped you decide to get vaccinated?
Yeah, to be honest, I'm not too sure why I ended up getting vaccinated. It's a question that I was still trying to figure out at the onset of the vaccine rollout. And so it was just a matter of when I decided to get vaccinated. I was living here in New Mexico at the time, and I was just having multiple conversations, especially with my parents and my closest friends who are first responders, and just talking to them about their experience with the vaccine. And so feeling at ease at the moment, and so I actually went to take my mother to get vaccinated, and so I wanted to be with her at that time. But at the time, they just had so many vaccines available, and so they just really there wasn't many people who were at the event to get vaccinated. And so at the spur of the moment, the PHN asked me, two? I was like, no, it's just her. I don't meet your age category. And then they're like, no, because we have so much available, you're able to get vaccinated now. And so at the time I felt very guilty, because just coming from a huge community, I would much rather have my older relatives and also those who are immunocompromised to get their vaccine before myself. But I just went through the process and got vaccinated 3 weeks later. I received my second dose. I got Pfizer. And then just more recently, I want to say on Tuesday, I got my booster as well. And so the experience was not too bad. Didn't feel any of the symptoms. And so here I am.
Thank you, Casey. And then Alec, how about you?
So very, very similar to Rory. So as a medical student, the vaccine was offered to me the first week of January. And, I was really excited that, one, I was eligible as a student, but I really felt kind of guilty inside for, wanting to, get the vaccine when I was in the middle of my, the first year of my PhD and, class was remote. I was just in my apartment at my desk and, I wasn't sure. I kind of felt that guilt when thinking about equity and who has access to the vaccine and who does not have access to the vaccine. And looking at the kind of priority system for how we distributed the vaccine, it made sense to me as a medical student, as a healthcare worker, as a researcher, but it didn't really make too much sense to me as a community member. How some people had to wait in place of others. And, when we think about who is most at risk, it's not because of their, individual behaviors, but the system around them that places them at higher risk of infection. So I had to grapple with that a bit. And, I think what I ultimately came to realize was, my father as a physician and me as a medical student, we were the first two from our tribe to get the COVID-19 vaccines. I always call my father Team Pfizer and for me, Team Moderna. It's a little rivalry. And, it was about the example that it set that, here are two community members who are in the healthcare workforce and they're getting vaccinated. And they're not just getting the same vaccine, one's getting Pfizer, one's getting Moderna. And, it represents the trust that we have in the system. And also, I think for me, I'm very privileged to have a physician as a father. I'm able to text my dad, ask him any questions that I have, talk about the research papers. And, not everyone in Indian country has that privilege or the access to this kind of complicated knowledge. And, I think that's what helped me decide to get vaccinated is, it's not just protecting myself, it's protecting those around me. And when you go around Indian country and ask, teenagers, young adults, why they're doing it, they're doing it for those in their household. They're doing it for those that they're visiting that may be immunocompromised. And I think that really sets us apart as a people for how we value those around us, not just ourselves.
Yeah, that's a really good point. Thank you, Alec. Let's move on to the next question. This one's less of a softball, I guess. So how have you personally seen vaccination efforts change in your communities? What have you seen that's worked? What have you seen that hasn't worked? What have you seen that's just kind of like, eh? Rory, if you want to start.
Yeah, I know there was a lot of uncertainty in the beginning, late December, January, even probably up until the early spring here in my community. But as I said before, and as Alex alluded to, it's just all about being, being role models in your community. Because my grandfather and I, we both got ours at the same time, same moment, end of December. Well, I'm an EMT, first responder. He is as well. He's an ambulance driver, and I'm usually the one in the back for a local rural volunteer agency here in New York, as well as here for the Seneca Nation. But I think when we've seen more of our people getting vaccinated, we've seen more of disproving some of the misinformation we've seen and we've read on social media, and we have people, I don't know if they're people or not, but we're spreading that misinformation. Some people really took it, really listened to it, but having more of trusted community people and having research and data behind you made all the difference. And it made a difference when I've had elders call me and say, hey, I don't know if I should get it. My aunt my cousin just called and said that, this, I'm gonna grow a third arm and stuff like that. And I said, listen, I said, none of that's false. And, just showing her key fact points that has been released not only by our Seneca Nation health system, but also national groups such as National Indian Health Board, NCAI, and then of course with the federal and state governments as well, has made much of the difference. And then, but I think the messaging helped a lot to getting one of our tribal members vaccinated. Big kudos to the leadership of the Seneca Nation for messaging correctly, and whether it was weekly community updates, sharing resources on where to get vaccinated, even if we couldn't at the tribal clinic at the time. We shared information about local pharmacies, local pop-up locations. I know my agency, the Seneca Nation EMS, set up our own vaccine pop-up in partnership with the county. So we've been had a great response here in the nation, all because leadership starts at the top, and the Seneca Nation has been really key in ensuring that we get more of our people vaccinated. I'm happy to hear this past week we've started to see more 5 to 11-year-olds receiving their Pfizer vaccine, which is incredible, and it just makes me so happy. I think it was in the summertime. My little cousin, who was 11, he was so excited to call and tell me he got his Pfizer vaccine, which just made me feel so happy that he's even taking the initiative, taking the step to get to that next level. So.
Thank you, Rory. Yeah, it is so exciting. It is truly so exciting. I echo those sentiments. Casey, how about you? What have you seen? How have you seen vaccination efforts change? What have you seen that have worked, that hasn't, that sort of thing? Yeah.
Yeah, I want to say on the onset of COVID-19 vaccine, especially at the early winter, early this year, there was many drive-through vaccine events happening, and so that's actually where I got my vaccine. And so that's a lot. That's pretty much what I've been seeing, and just talking with my family members and asking them like if they've got their vaccine, and those that are older, they've been communicating with their physician or with their hospital and setting up those appointments as well. And so I think that really in a way really helped to get the community vaccinated, is to have those events. And so I want to say after I got my vaccine, I kind of didn't really pay attention to the vaccine rollout. So I'm not too sure really how it went for those the age groups as they continue to trickle down onto the teenagers, and now more recent with the children. But with that, now that boosters are starting to become available, and the same techniques are happening. And so where I actually got my booster was actually at a drive-through vaccine event again. But I want to say, those are good, the mass vaccine efforts. But one of the reasons why, personally, I felt guilty is because when I first got vaccinated, we just had a huge snowfall, and within the Navajo Nation, we're very rural, and a lot of our roads are not paved. And so for our older relatives, if they have access to transportation or not, then they're more likely gonna come to this vaccine effort. Or if their road is good, if it's not washed out or anything, then they'll most likely be there as well. And so those are some of those are the systems that they're in, right? And so really trying to navigate the best resources and try to get those vaccines into their communities, not just border towns or the nearest hospital and such, but really within their community. And I see that kind of happening, but a little bit more of a push for those that don't have all the resources needed.
That's a really good point. Yeah, thank you, Casey. Alec, how about you?
I think Casey kind of got to my main point right at the end, which is you have to meet communities where they are. I remember very early on, I was getting a little antagonistic with the county supervisors in San Diego because they were organizing these mobile vaccine pop-ups across San Diego County. And I put up a map of the reservations and overlaid it with where these pop-ups were. and one-way driving from, I think, like the farthest reservation would be 45 minutes without traffic. And that's not equity, that's not access. You have to bring the vaccine right here to the shoulder. You can't rely on people coming to you, because people don't have the luxury that is time when trying to take care of their household, trying to take care of their elders. So that's one big evolution that I saw was how can we get out there? And the county partnered with the fire department. So we had our tribal fire departments offering vaccines. We were getting vaccines out to the casino employees and staff. I'm really making sure that everyone, Indian and non-Indian, who was having business on the reservation, was able to get a vaccine if they wanted one. And I think that was a big motivation for me is, from my desk, what can I do? And I was able to partner with several people at UC San Diego Health, and we brought 600 vaccines out to the Rincon Indian Reservation. And, I think that was a true kind of commitment from, a very big institution for a very small community, but a very small community that needs it and needs, that strong partnership. And the other thing too was, I think back to my vaccine experience. I had to drive to a hospital and walk through hallways and then sit in a waiting room, and it takes a lot of time. And again, people don't have that luxury. So when I got my flu shot a few weeks ago, it was just a drive-through clinic at UCSD, and UCSD has started giving the COVID shots through drive-through clinics. So on Wednesday, I'm not going to have to drive all the way to the hospital and back, but I can just sit in my car and sit in a parking space as I wait 15 minutes after I get my Moderna booster. So I think we have to learn to be flexible, and we have to acknowledge that the public health infrastructure for Indian country has long been inadequate because we've really overlooked it. And it's unfortunate that it takes a pandemic to really act on a lot of these needs.
Yeah, you're so right. You're so right. All right, we can move on to our next question. Have you had to convince any friends, acquaintances, coworkers, family members, any of that to get their COVID vaccine? And if you have, what kind of helped you to get that message across? Rory, you want to start?
Yeah, we'll just say I still am too to this day. It's been doing this for going on a year next month, but always happy to provide my experience receiving my 3. And I also like to share. I also sometimes share about how important it is, and how what devastation this pandemic has brought, not only on Indian country but across the United States and across the world. And I remember it was hard sometimes, administering COVID tests last winter, and sometimes it was the last time I seen some of those people, unfortunately. But the community knows that too. We've all been through the heartbreak. We had so many instances of families unfortunately passing at times because of the pandemic, just throughout 2020, even still today. But I guess the best thing best advice I've had to share to close family members, and I'm not gonna say what the relation is. We'll just say they're very close. That this is our step out of this. This takes all of us, to do this, or to get through this pandemic. Just one individual action can help save a life, and just getting on that deep level and sharing. How, of course, if you want to get out of this faster, you have to. Fortunately, you have to go show off your arms for a little bit there, and get a little poke and pinch. But the benefits far outweigh the consequences. I know there was issues, with one of the vaccines this past summer with a medical issue, but the conclusion being that the benefits far outweigh the risks. That there might be medical side effects from the vaccine, but they eventually subside. But you're that much closer to being able to bring back everybody together and kind of get some semblance of pre-2020 back and moving on and moving forward in a healthy and positive way.
Oh, my laptop is frozen.
Well, I can go ahead and go while Darby go ahead and get situated. So I want to say that you're still trying to persuade people to get vaccinated is one of the ongoing issues, especially within like my community and some of my close relatives, especially those that are younger than us, my nieces, my nephews. Well, I actually call them my cousins because they're not too far young from me, but just the belief from their family, their parents is that they're young and they have a strong immune system so that they could combat this COVID-19, if they got it. And so really trying to bring those conversations into the household and just really trying to understand why is it that you do not get your child vaccinated, or why did you get your child vaccinated? Alec mentioned it earlier, is that these young people are seeing what their family experiences. And so, whether COVID came into their household or not, they've seen some of their relatives struggle with it. And so really trying to prevent that from happening. A lot of my younger relatives got their vaccine. And so really, I think overall, just trying to point out like the benefits of getting vaccinated so that we can, return back to normal, whatever that is, again.
Yeah, I mean, the normal that we did have, wasn't that great to begin with. So I mean, if anything, I hope COVID pushes us towards a better normal, one that really centers justice and making sure that we don't leave anyone behind. I think for those who I knew that were hesitant or kind of against the vaccine, it was kind of just like a finger snap where that sentiment switched as soon as someone that they immediately knew, like a friend or a family member, was affected by COVID-19. And if it was a mild case, if it was a severe case, it still hit home. It's like, oh, like this is real. It's not just something that I'm bashing on social media. And it's so easy to post a problem or to complain, in your latest tweet or your Facebook status or, a comment on a video. But, the fact is, it is real. And, it's motivating your friends to get vaccinated with you. That's important. Trying to debunk misinformation, that's important. It's easy for me as a medical student to say, if you get this vaccine, there's a 20% chance of this or a 30% chance that you'll have a headache. But you can't be that technical. Just say, if you get vaccinated, just plan on taking off tomorrow. Plan on getting some ice cream because you're going to feel a little sick. But when you weigh the benefits and the risks, like Rory said, I think you'd rather have a headache than be in the hospital. You'd rather feel a little like slimy than be on a ventilator. And I know that imagery can be very graphic and really cause a lot of emotion, especially for those personally affected by it. But I think our own experiences are the best motivators for people who are hesitating to get vaccinated across that line, because in order to get out of this, everyone has to get vaccinated, and we can't have these kind of pockets of people who aren't. So it takes time and it's a process, but I think I think we're making progress. So, you know, text that friend, tell them, hey, I got the shot, like I'll go with you. Extend that hand, because I think it's really helpful.
Thank you so much, Alec, for sharing and really talking about those different factors that we should consider, especially for first responders when you are interacting one-on-one with your community members. Leading up from that question, could you and also the other presenters, Casey, Rory, please feel free to jump in if you have anything. Can you just go into a little bit more details, Alec, about what you think is missing from COVID response in terms of how first responders are answering the call to serve in their communities, and what is missing in terms of getting COVID-19 vaccine information to communities, just from your perspective from working in the field?
Yeah, so as a public health researcher right now, I think, and I'll keep this very short with our time limit here. I think one thing that's missing is that kind of personal kind of dinner table touch, where if you post a flyer on social media, that just kind of stays on social media. I think where you really convince people is over food, or while you're doing something recreationally, like going on a hike or going on a swim, and just having a heart to heart, and having that one-on-one conversation, because when you're giving your time to one person, they know that it's important to address this topic. So that's where I would start. The human touch. We're all in this together. We all have a different relationship with COVID-19. But sometimes it's best to kind of take off your white coat, or take off your gear, and just speak person to person.
Yeah, I can go down and hop on and just piggyback off of that, just having that personal touch. And one of the things that I'm learning, especially within tribal communities, is just how much trauma lives within those communities. All of these systems that we're placed in presently, and Alec alluded to it. It took a pandemic to show all these inequalities that live within our communities. But what we're coming at it through multiple angles. Public health messaging, physicians messaging, and really trying to in a way, just take a step back and let the community heal from everything that has happened over the last year and a half, and really, just be there with them and add that personal touch to it, because over the last year and a half, we've been so disconnected from our ceremonies. We've been so disconnected from our family, our relatives, and our community as a whole. And so just talking with them and furthering the education on this vaccine, and to use yourself as an example on why someone should be getting this vaccine, because not everyone has a doctor in their family. Not everyone has, public health professionals to talk to them on why the COVID vaccine booster is necessary, and just to break it down for them so that they'll understand it, and they'll understand the system that they're trusting overall.
So powerful. Oh, so powerful. I think I'm just gonna jump in real quick right here as we start to wind down. I think you both hit on something that I think is kind of a theme that I'm not native, but it is a theme that I have heard when I have listened to the tribal members speak at the White House summit earlier this week. And it's a theme that I've heard today with several of the sessions where it is a little harder for not just tribal communities because you're in a rural setting, but because you all have so many traditions. And like you just talked about, you so far away, like COVID has really affected tribal communities in ways that someone like myself could not understand, because you all have your own sense of community and values and traditions that just been stopped, that's been paused. And now you have all of this new information that's coming at you, and it can seem overwhelming. So this is the time where more one-on-one is more beneficial than social media and TV. Like, right? You're so right. Like, I totally understand. And Rory, I see your head nodded. Is there something that you wanted to add?
I just want to agree with everything all the panelists and then you have stated as well. That, you know, this pandemic did expose a lot of shortcomings, not only in any country, but across the United States. So, you know, unfortunately, we had to go through this pandemic as unfortunately some sort of a wake-up call to show the lack of emergency preparedness, the lack of appropriate infrastructure. But it also showed that that we are stronger together when we get through this. So kudos to the many tribal leaders and community advocates who advocated for kind of rectifying a lot of these miscomings that the pandemic exposed. But we're only going forward now, and we just have to continue to being advocates for our communities, listening to our fellow tribal members, and doing what we can to advance this. So unfortunately, if this does happen again, that we're a little bit more prepared, and you know, we'll come out stronger as well.
Thank you. And I would echo what I know a lot of the attendees are thinking. The three of you are very courageous. And I personally just want to thank you for being so vulnerable during this session and for being so transparent about your feelings and your emotions. I've cried a little bit today, but it's worth it because I can feel it. I can feel the passion. I can feel it's heavy and it's a lot. And we have a lot of work to do, but I just want to, you know, as we come to the close, I do want to acknowledge and just take this time and just say thank you. And to any of the other attendees, if at this time, if you want to show some love to them by saying thank you and acknowledging them, please use your reactions. I'm a reactions girl, and show our presenters some love, give them some hand claps, because it takes a lot to do what you all are doing, and you're doing it every single day. And like you said, you're losing your loved ones, so it makes a difference. So thank you. So with that, let me get myself together. Darby is back, so I'm going to give my colleague back her role.
Yeah, sorry about that. My Zoom froze in the middle of me trying to just unmute and respond, and I was like, well, I don't know what to do. But I am back just in time to close us all out. So thank you, panelists, every single one of you, Alec, Casey, Rory, you guys did great. And you had some great answers that I loved hearing too. If attendees, if you have any additional questions for any of the panelists, you can go ahead and send me an email. That's not what I was. There we go. I'm posting my email in the chat. You can send me an email and I will make a list of all of the questions, send them off to our panelists, and we'll get an answer back for you. I do want to tell everyone to enjoy the rest of the Youth Summit. We have one session left that starts at the top of the hour, so just about 20 minutes. And then after that, we'll be done for the day. So thank you again, everyone for coming, and have a great rest of the day.